Hey y'all, welcome back to my channel, The Purpose Nurse. If you haven't been on my channel before, but if it is your very first time, then I just want to say welcome. I'm Jalen, also known as The Purpose Nurse, and on my channel I talk about faith, purpose, nursing, and inspiration. If you're not subscribed to my channel, please feel free to go ahead and subscribe, and also hit the little bell for notifications so that when I post a new video, you will be notified. So today I'm going to be talking about should you or should you not apply to a new grad nurse residency program. If you guys haven't already seen it, I posted a video about my first new grad nurse residency program interview. It should pop up somewhere up here and then you can just click on it to see how that interview went. But without further ado, let's get into this video. Okay y'all, so what exactly is a new grad nurse residency program? So a new grad nurse residency program is for, you guessed it, new grads that graduate from nursing school and are ready to transition into the nursing practice. Now, typically these new grad nurse residency programs are 6 months to a year long, and at particular hospitals they also have the new grads do an evidence-based practice project that will typically take that 6 months to a year of the program. So what is evidence-based practice? It's exactly what it sounds like. As nurses and nursing students, we provide care to our patients that is based on evidence. We don't want to provide care for our patients if we don't have evidence that it's actually working, which actually makes a lot of sense. So as new grads, what the hospitals have these nurses do is look up a topic or figure out something that's going on in the hospital that may need to be worked on or improved or just emphasized a little bit more. And they have these new grad nurses work on a evidence-based project to spread out this information and just inform other people about it, find research studies, and just continue to show that these interventions that we're doing for our patients and the care we're providing to them is adequate because it's backed up in research. Now, I feel that new grad nurse programs are important to apply to because if you're not applying to one of those programs, then you're just applying to a hospital like an experienced nurse would. And you're saying, how is this really different? Well, because the new grad nurse residency programs, you get paired with a preceptor. A preceptor is a experienced nurse. Normally they'll have about 4 years plus experience, or they could have 2 years plus experience and up. You don't really know, but you do know that they are more experienced than you are. They're more experienced than the new grad nurses, and it's kind of like a hand-holding thing. And I personally would like that. I would like for my hand to be held because I want to make sure that I'm providing safe and competent care to my patients. And so I would definitely prefer a nurse residency over just applying to a hospital and starting and not having that support that you would necessarily have if you did a residency program. Now, there are residency programs that are 6 months long, and there are residency programs that are a year long. I would prefer to do one that is a year long just because I feel like a year is a good amount of time. Now, 6 months is a long time too, but I just would prefer to do one for a year because I feel like that time frame just sits better with me. Now, I wouldn't mind doing one for 6 months, but we all have our preferences. I think it's important to look into these nurse residency programs and look at what the requirements are and look at what you will be doing, because as a new grad in these residency programs, you have extra classes that you're having to take for the program. As I already mentioned, you're doing projects, and some of these programs you're starting off doing 5 days a week, and then they transition you into doing like 312s or whatever the case may be. But I just really feel like as a new nurse, I want to be safe and I want to develop my competency, and I feel like for me a new grad nurse residency program is going to do that. And I also feel like they know how to best treat you and develop you and see, okay, you wanted to do an ICU new grad nurse residency program, but maybe you get onto that ICU floor and you're not flourishing or you're not doing your best. Typically in new grad nurse residency programs, if they see that you're not flourishing on that ICU floor, even though you wanted to be there, they may say, okay, doesn't seem like this is really a good fit for you, and they may send you to a med surg floor or another unit, but they're able to work with you. Whereas if you're not doing a nurse residency program, I'm pretty sure that things would go a little bit differently. I just really want to fully develop and develop at a pace that's, I would say, comfortable for me. And in nurse residency programs, that's what they do. That's what they're for. They're there to support you, to lift you up, and make sure, again, I can't say this enough, that you're safe, and eventually put you into leadership positions. Because when you come out of nursing school, let's be honest, nursing school teaches you the basics that you need to provide safe care and keep somebody alive. When you go to your specific hospital, they're going to teach you the protocols and how things run for that hospital. So how it runs at this hospital may not be how it runs at the next hospital. So it's really important to understand that what you learn is going to be according to your hospital. It's not going to deter from the basics that you have already learned in nursing school, because those are fundamentals. Like the basics, every nurse needs to know fundamentals, but then you have those different layers on top of that for whatever specialty you have, whether it be ICU, med surg, ER, oncology, or geriatrics. You have to learn the additional skills on top of those fundamental skills. So I definitely think that you should put on the top of your list applying to new grad nurse residency programs. If you don't get into one, it's not a big deal, but I definitely think that you should aim to apply for one. That's what I'm going to do. I'm going to apply for multiple programs in the state of California and outside of the state of California, because I don't know where God wants me to be. I don't know where he's going to place me at. I don't know where he wants me to work as a nurse at. That's up to him, but I trust him and I know he's got me. He hasn't led me this far to leave me. So that's all I have for you all. I hope this video was helpful. If you like this video, you already know, please give it a thumbs up. And I'm going to say it again, if you are not subscribed to my channel, please go ahead and subscribe, and again, hit the little bell so you receive notifications every time I upload a new video. But until next time, you all, be blessed.